Thank you, Derek. As I was listening this morning, I was able to kind of categorize summarize the presentations through four overarching themes. The first is that all the presenters agreed that further research on the links between the environment and nutrition guidelines must include social and economic dimensions. And that theme was also presented yesterday, that it can't just look exclusively at those 2 points. It's a much more complicated and complex issue. The second theme is that there seems to be a consensus that incentives to spur behavior change have to be tested before being implemented, and that we need to think about how holistically all these different types of prods that are trying to be carried out, what that will mean when they add up. Is it more than the sum of the parts, or is the parts not enough to get us to where we need to be in terms of the sum? George Lowenstein's presentation, I think, gave a lot of good insight into what incentives motivate consumer choices. The third theme, just building on what Derek had just said, is that there is a significant role for the public sector, and in the United States, definitely for the U.S. government. The presenters from the first panel this morning made the good point that public sector action has to be much more collaborative across agencies, and it needs to bring a much wider set of perspectives, all that are working on the full range of the issues to bear when we're thinking about policy. Catherine Clancy really made the point that there needs to be greater consciousness about the priority of sustainable diets being a legitimate policy issue, and that really is going to be the impetus to get the full range of actors that are needed together to make the policy that is smartest for the issue and ensure leadership and support for the implementation of it. There also was a suggestion by Tim Lang that we need to, when we're doing more public collaborative processes, like the development of the dietary guidelines, that we need to be more intentional about incorporating other perspectives. He had raised a point about bringing in 2 environmental scientists, for example, into the updating of the U.S. dietary guidelines. There seems to be a consensus, too, that consumers, are not using the information that is being provided, whether it be through labeling or about the impact that dietary suggestions or our current diets have on the environment. People aren't able to digest that information, and perhaps there might be new ways that it could be presented to better incentivize the behaviors that we would like to see changed. I thought there were some good suggestions about how we might be able to use the Farm Bill, although to better address the issues that are being discussed in this conference. The Farm Bill is imperfect, and maybe it won't even happen this year. I guess we don't know. But there were 2 suggestions about how we might be able to adjust the price signals and incentives to farmers to better align with healthful goals, and that we might want to look at how we can use the current CS stewardship program to better take into account environmental goals, especially those that will support healthy eating. There was a very big emphasis on the need for more public research. It was terrific that the presenters pointed out that U.S. investment in agriculture and food research overall is actually on the decline. China is actually the world's biggest investor in public research, agricultural research now, and that even in this era of fiscal austerity, we must prioritize investments in agriculture and food. And there was also good points, I think, too, about how we can't do it as we've done it in the past. Research has to be more multidisciplinary. It should look not only at USDA, but also at bringing in National Science Foundation and potentially been doing some collaborative research with the National Institute of Health, maybe the Department of Energy, the Environmental Protection Agency, so you are able to really look at the environment, health, agriculture nexus through the lens of those economic and social constraints as well. Jennifer Wilkins outlined some research priorities, not only, I imagine, for the public, but also for other actors moving forward, that touched on, again, healthy food access interventions, the relationship between food skills and waste, the social impact of our food systems, and better understanding the differences and the impacts of highly concentrated food systems and local and regional food systems on the environment and on health. Derek made the good point, too, that we absolutely need this public voice, but there are actors beyond government that will be able to help engender change. And there was a couple of very good suggestions this morning. Tim Lang raised the point that the United Nations could play a role, potentially a WHO, FAO, UNEP report, or potentially an intergovernmental panel on sustainable diets that may be of the same stature and maybe have the same kind of long-standing impact that something like the IPCC did. There's also an opportunity for private companies to take action on this. Derek flagged the World Economics Forum New Vision for Agriculture group, which is looking a lot at agricultural development, but is slowly merging into the health issues. There might be an opportunity to leverage that group. And he also raised the investor community and the reinsurance world and the retail groups as places where we might be able to get them on board to discuss some change. Tim Lang this morning suggested maybe putting up some watchdog groups that would be able to bring together experts to monitor how dietary guidelines are being implemented or potentially how they're impacting the environment, and use that as an information resource for policymakers either in the United States, or it could even be a more global or regional approach. And then finally, as the impacts of nutrition and the impact of sustainability are increasingly presented using economic terms, this may end up being an issue that could be addressed maybe even in the G8 or G20 forums. I'm sure that this is not a comprehensive summary of our discussions today, but an excellent dialogue, and I appreciated the opportunity to be part of it.
Thanks, Lisa. Let me just say that the next step in this process is that there will be a report prepared on the meeting. And I think we also want to remember that the Institute of Medicine's role is always critically to convene on the basis of the best evidence, encourage a discourse, particularly the multidisciplinary discourse, and the responsibility for action then falls to us. And I'm sure that there will be many actions that you'll think of following this meeting. But before we end, let me just end off by thanking all of you, the moderators and the speakers, the planning committee under the able leadership of Eric Olson, and most importantly, the Institute of Medicine staff, Andres Gaviria, Heather Cook, Leslie Sims, Geraldine Kennedy, whose tireless work in keeping us together, bringing this into fruition, is done in a way in which is always exemplary and a huge pleasure to work with. So let me thank you all, and I hope you travel back safely. Thanks.